Good afternoon, everybody. Thank you so much for your patience. We had an unfortunate event in terms of as soon as we were ready to start the webinar, our system crashed. But hopefully we have everything up and running again as needed. So again, we do apologize. Melinda's with us today. Melinda's floating in the
Hello.
background. Hi, Melinda.
And my network connection is slow, so I've turned off my webcam for today.
Sure. Thank you. And Bill's with us as well. Bill will be leading through the process today, along with Melinda. And feel free to post any questions in the question box. We will be monitoring those and responding when we have a good time. Seems like we do have connectivity issues just across the board with the system today. If you happen to get knocked off the system or have some type of audio issue, that type of thing, just use the same web link to log back in from the original invitation confirmation page or confirmation email, and that should bring you right back into the system. We are recording this as well, so we want to get this up on the help desk as soon as we can. Later today, actually, is the goal, as well as having the slide deck posted. So we have lots of information to cover in a pretty brief period of time. Look forward to talking with everybody, and thanks so much. And Bill, I'll give it to you.
Okay, everybody. I'm hoping everybody can hear me. Jamie, can you hear me?
Yes, sir.
Okay, just want to make sure. When he talked about technical difficulties, everyone, you should be aware that it's me. I don't usually use this computer for GoToWebinar, and I've been trying for the last 25 minutes or so to get it to work right. So, so welcome, and sorry for the delay. This is obviously moving your system forward. This is the last webinar training that we have scheduled live, right? We'll talk more about that for future things that we're going to be doing. So let's just jump right in, given where we are. As Jamie said, if you have questions, please feel free to put them in the question box. We can address them as we go. So as usual, we're going to provide some information that you've already had, just as a reminder of where we are. And we're going to talk about community readiness, what that means, and we're going to talk about comprehensive prevention, and then at the end we'll describe what the next steps are, including understand a video being set up and some TA sessions and maybe some dates, and still some templates that we will provide for everybody. So just so everybody knows where we are, right? This was the outline that we presented a month ago. And the green arrow indicates where we are now. So we have gone through collecting, prioritizing consumption and consequence data. You've collected theory, hopefully collected intervening variable data, did some midpoint check-ins with most of you. Then we were able to prioritize the intervening variables, assess organizational capacity. We'll talk about that, review that quickly as we get towards the end. And then today we talk about readiness and comprehensiveness and what they mean. So the process in terms of the way that we've gone, this is what it looks like. We've identified the high concerns, identified the priority intervening variables, and now we're focusing on the changeability aspect. The first few elements of changeability we've already talked about, but we will review them quickly. And then we're going to get you to selecting interventions and some things to keep in mind when you're selecting interventions. So you might remember this. This was a slide from long ago, back when I used to be able to travel and stand right in front of you all, which I prefer to this one, to this format. But remember, this was trying to figure out what effective prevention is, and part of effective prevention is making sure that we're not trying to do too much, right? That we're picking only those only that high magnitude problem or problems, that we're only picking those priority intervening variables, And today we'll talk about only using those strategies that are going to get us the furthest with reducing those intervening variables. So let's start that conversation right now. Some review stuff and some new stuff on comprehensiveness and how we've already talked about that. So this, again, might look familiar to some of you. These were the three primary elements, three of the four primary elements that we talked about comprehension in the first session. That is the Institute of Medicine Continuum of Care, and within that, what we pulled out was universal, involves direct and indirect. We talked about the CSAP strategies, the multiple intervention types. You're all familiar with those. And then we talked about the social ecology model. And those are the three that we're going to cover very quickly in review and talk about how that applies to what we're thinking about when it comes to designing a strategy set that is comprehensive. So most of you probably already know this, but I just always want to make sure that everyone's on the same page. We talked about the two different kinds of universal prevention. There's direct, and the example for that is identifiable participants. So students in a classroom, for example, would be an example of direct universal prevention. Indirect, we don't know necessarily who the individuals are. We just know the target group that we are trying to address. And so they are considered population-based because they involve a much broader scan of the population than direct does. And again, most of you probably already know these because you've already identified them the last go around. You've also worked heavily with the CSAP strategies. So I think we'll just cover these very, very quickly, right? In terms of, instead of kind of defining what they all are, most of you are aware that the top three strategies, community-based processes, environmental strategies, and prevention education, are what are called the core strategies, and they are called the core strategies because, in part, the research has indicated that these three strategies are the most effective. And if you had a choice between doing any of these by themselves, for example, you'd be better off choosing one of these three than any of the other ones. But as we'll discuss, none of them really work as effectively by themselves. The other strategies are called support strategies, and sometimes there's some confusion on these, and I hope to clarify some of that today. Support strategies are just that. They are there to support either one, two, or three of the core strategies that you're engaged in, right? So when we are involved in information dissemination, when we're thinking about what type of information and to whom we're going to disseminate it, it should be directly related, for example, to maybe one of the environmental strategies that we're trying to engage in. And the same with problem ID and referral and alternative activities. They should be there not as standalones or separate pieces, but they should be a part of the core strategy. And we're going to give an example of what that might look like in a few minutes. And of course, you probably remember this. This is my favorite thing in public health. The social ecological domains refers to the fact that we are all engaged socially in communities at various levels, and that a comprehensive perspective from this perspective, is that we are going to engage people in as many of those social environments as possible. So while you're not expected, per se, to identify which of these you're operating in, I will lay out an example that will show you how you can incorporate this into your thinking around comprehensiveness and what that means. So the goal then here is to select multiple CSAP strategies, and of course by multiple, the more of them you do, the better, and as many social ecological levels as possible. And in doing that, then, the goal here is to talk about how we can have these these prioritized actions that we're engaging in working together, right? So we're going to do direct and indirect, we hope, but that's going to overlap at some level with the reinforcing strategies that we're engaged in, the CSAP strategies. Those CSAP strategies, we hope, are going to occur in multiple social domains, and we are going to have multiple CSAP strategies as we move forward, the core strategies as we move forward. So the sweet spot in all of this is where all of the circles intersect. That is to say that we have not just identified who is getting the strategy implementation, but we've also overlapped that with where it's going to be delivered, how it's going to be delivered, and what strategies we're going to deliver. All of that intersects in the middle so that we are including both direct and indirect, involving all the strategies and involving all the domains. So words of the wise, I guess, in terms of how some of this might work. And I wanted to include this because I think that, you know, my experience in working with coalitions is sometimes they think that the more stuff they do, the better, and that's not always true. So I wanted to just use these as a descriptor. It's not the number of darts or strategies that you throw at a problem, it's how accurate you are in applying the strategies to the intervening variables that you're trying to address. So in the world of comprehension, it's important to remember that more is not necessarily better, that it's more important to be accurate than it is to have more strategies. Okay? This is because sometimes we engage in strategies that may not be, that we may have trouble directly linking to the intervening variables. So we always have to be able to make that link there. And so what we thought would be a good idea is, and now there's a lot on this to digest, but we thought it'd be a good idea to provide an example. So this example is about lockboxes. As you can see, the problem that we're trying to address is prescription drug use, specifically that youth are saying that they are accessing or stealing prescription medications from home. So the overall strategy that we're trying to present here is to provide community members with free lockboxes, right? That is what I would refer to as our, it's referred to as the core strategy, as we'll get to in a second. But in the end, that's what we want to be able to do. And so we're going to build a set of strategies around providing free lockboxes so that we can cut down on the number of youth who have access to prescription drugs that they shouldn't have access to because they're stealing them from home. So let's talk first about the examples here that I have for universal and indirect. And as we go through this, you're going to notice that there's going to be some overlap, which we should have, because obviously some of the CSAP strategies will overlap with direct and indirect, right? As you know, because you've already been working in these. So direct would be, the first thing is a school-based program on ATOD that would include conversations or perhaps skill building on prescription drug use, right, and avoiding prescription drug use. Notice in parentheses, I have the word individual. That's because for some of these, I thought it would be a good idea to show you that we can work multiple domains of the social ecology model as we design our strategy set. And in this case, a school-based program on ATOD would be considered individual because we're trying to build individual skills and change individual behaviors through that program. So in the social ecology model, that would be individual. An indirect universal approach might be, and I've worked with communities who have done this, passing a new construction or lockbox law in the community, right? That whenever you're going to build a new house, part of the specifications for that new house is that there has to be some type of a lockbox for prescription drugs there. And if you were to pass such a law, obviously that would be community level, right? Because every new house would be impacted by that. Under the CSAP strategies, community-based, sure we don't have to talk a lot about that, right? But it's the coalition bringing together the special partners that they're going to need. And if we're thinking about providing free lock boxes to people who are already in houses, we need to be able to cover the costs, and we need to be able to distribute them, right? So it's possible on a daily basis that our coalition really doesn't have access to people who can do that. So we're going to reach out and see if we can get maybe some business owners to help pay for the lock boxes. We're going to find out if we can rely on other organizations that are dealing with other partners who can help us distribute those lock boxes so people can go pick them up at certain places maybe, or maybe there are even people who will deliver them. I've worked in communities that do that as well. They have a delivery service for the lock box. If you want it for free, they'll bring it to you. So as a coalition, we would probably need partners on board who may not necessarily be a part of what we're doing right now if we've never worked on prescription drugs or we never worked on lock boxes. Under environmental strategies, of course, providing free or low-cost lock boxes, and this is one of the strategies that is listed on the strategy sheet, and that would be a community level, right? Because again, we are providing lock boxes to anyone who wants them. There's no specific group that we are focusing on. We're also going to offer prevention education. And so maybe one of the things that we would do under this is to train school counselors on the signs of prescription drug abuse. That would be at the school level, or at least to make sure that they understand what the signs of prescription drug abuse are for the students who may come into their office. We would also perhaps have some type of family-based programming on ATOD use, and that would be because family, of course, is a primary place that youth are learning about prescription drugs for. So it would be good to get families involved, and there are a variety of programs that we could run that would do that. And as you can see, that would cover the social ecology domain of family. For information, now that covers, right, these three core areas. Now let's look at how the other ones would relate to those. So for information dissemination, we're going to provide potential partners and maybe the community with the data and consequences so that we can raise the awareness in the community so that we get more buy-in. And probably we're going to distribute information on why the solution to that, lock boxes, are important. And we're going to pass information along on how easy it is to use and maybe to obtain the lock boxes that we're providing, right? So in this way, we're providing information to the community that not just increases their knowledge, but also increases their comfort level and maybe even their skill level in using the boxes. So the information that we are selecting is going to help us distribute these lock boxes and get people to use them. With problem ID and referral, we may have some type of training or provide information to doctors and pharmacists on signs of prescription drug abuse so that they can hopefully refer people that they think are suffering from this. And then we might also provide them, that's why it says same, doctors and pharmacists, we're gonna make sure that they are aware of the Lockbox program and maybe even try to get them to be a distribution point, if we can, about these lockboxes. So they're not just IDing and referring about prescription drug use, but they're also IDing and referring. They become a referral source for the solution, which is the lockboxes. And then on alternative activities of some type of leadership program on prescription drug abuse prevention that focuses on youth, right? That empowers youth to take an active role, more than just maybe coming to a coalition meeting, more than just being a resource point for information. So we're gathering youth together in listening sessions. We're talking about, for example, the Dover program, which has this leadership that gets youth actively involved in prescription drug prevention in the community, giving them a leadership role in that. So when we look at this, and that's at the individual or peer level, depending on what type of program you're dealing with. So there's a couple things, right, that we can look at in this, again, just to reiterate. First, notice how we have covered all of the areas. We're doing both direct and indirect, and we have engaged every CSAP strategy. Also notice how all of the CSAP strategies support our primary strategy. I refer to that as the spine, right? And everything else is there to support it. And that spine is providing free or at least low-cost lock boxes to people. And so everything that we are doing in some way is trying to help us get lock boxes into the hands of the people who need them, and at the same time try to decrease people's, especially youth's, desire to take prescription drugs. So all of it focusing on that issue. I just want to pause for a second and make sure that see if there are any questions about what you are looking at right now. This, by the way, is what we would refer to as alignment in comprehensiveness, where everything is pointing in the same direction. So if you have questions as we move forward, please feel free to jot them down. So I guess we'll just move forward. So that's for comprehensiveness. Comprehensiveness, again, making sure that we are covering all of our bases, making sure that we're engaged in as many CSAP strategies and direct and indirect as we possibly can. And again, notice, I guess I can't, let me go back for a second. Notice on here that we're really only engaged in a few different things right here, but they are all pointing in the same direction. So we're not just providing information on anything. We're not just having alternative activities just that keep youth busy, right? They're all targeted. So in terms of capacity then, are we ready to do that? Let's do a quick review on what capacity refers to, or sometimes folks have been calling it changeability. I think I've referred to it as that a couple times. And this really asks the question, will we succeed? So we come up with all of these plans. We've identified one or two of the problem behaviors. For each problem behavior, we've identified a couple of intervening variables, maybe. We've come up with some strategy sets. I apologize, my cat just walked across the screen. I don't know why. Cats just seem to be obsessed with using the computer. So the three questions that we're going to ask ourselves, this is a quick review, is how deeply rooted is the behavior, right? How dependent, I guess, is our community on this problem behavior? How long has it been occurring? All of that. Do we as an organization have what it takes to implement this change, right? Do we have the skills, personnel, all that? And the last question, right, is this, you can take a horse to water, but maybe not make them drink, is the community ready? So even if the problem is not deeply rooted, which we would hope it's not, because then it's easier to change, even if we know that we have the organizational capacity to logistically manage the change, maybe the community's not ready for it, right? So we're going to run into some big hurdles if that's the case. What we've already talked about with changeability are these three areas. So hopefully this looks familiar. We did this a few weeks ago. And from an internal perspective, this is where you look at your organization and you look at what it is that you're trying to change and say, do we have the human capacity, which refers to skills and experience at the table? Do we have people who have worked in this field, who have worked, maybe if we're doing prescription drugs, do we have people who know a lot about prescription drug use? Are we able to evaluate what we do? Do we have people who have those skills within our organization to do that? These are all the types of questions that we would be asking. The access and planning piece refers to fiscal, which means do we have a history, for example, of being able to budget properly, come in on the right budget, predict budgets accurately in terms of what we need. Do we have fiscal policies that will help us move resources where we need them, sometimes on the fly if necessary, right? Do we have those types of mechanisms in place? So these are some fiscal considerations. And then the last we referred to as organizational considerations, which I kind of labeled as culture and communication, right? And I decided it would be fun to misspell communication, which I just noticed. It's double important there. So double T. So culture, of course, this idea of, are we a culture of change? Does our organization view itself as a change agent, a change leader in this type of field? With communication, which I just think is hysterical that ironically I misspelled communication. I'm sorry if you could see me grinning ear to ear. Are we able to communicate internally about the things that we're trying to do? Do we have regular internal communication practices that make it easy for one group within the organization to talk to another group, and also the external communication? For the partners that we're going to need to do what we do we have some type of either formal or informal but systematic communication process that works for both parties? So we're going to ask all of that about our organizational capacity to do the work within our organization. So in addition then, as we talked about, there's this other element, right? Because what we're talking about is, can we alter things? Now remember, we're not trying to alter things within our organization. If we were, then human capacity, organizational capacity, and physical capacity would really be all we would need to think about. But in this case, we're trying to influence things that are outside of our control as an organization and things that are going on in the community. So what we really are thinking about is, can we impact these intervening variables in the community? And so the piece that we have to add to changeability is this piece of community readiness. So let's talk a little bit about community readiness and how we're going to hopefully help you assess your community's readiness for change. So with assessing readiness, then there's a couple reasons that we have to do it, or it's helpful to do it. I bring this up because community readiness has been more popular at some times than it is in others. It was very popular in the mid to late 90s. It was something that everybody was doing, everybody was talking about, and then it kind of drifted away, I think, through the early 2000s. It is making a comeback now, and we'll talk about kind of why that is. But there's a recognition now that I think speaks to the role that community readiness plays. And so the first role that it can play is that it can help you determine the level of and types of resources that you're going to need, because in a sense, becomes part of your community assessment, right? What's already out there. Obviously, the more resources related to community change in the area that we're thinking about, obviously the more of that's already in the community, the more readiness we're going to have. Right? So it's important for us to know, where are we going into this? And then the other piece is, we firmly believe in the idea that you should always start with what people know. That you never want to start in a place that makes people feel more uncomfortable than necessary. Most people are uncomfortable with change. And the way you do that is you meet them where they are. The example that I used yesterday sprang to mind again with all this webinar stuff. Many of us have become informal math tutors for our children who may be at home learning math. I, for one, learned a lot about factoring, which is what my daughter is currently covering. And of course, the reason that she's doing all this math now in 8th grade is because next year in 9th grade, she's going to be expected to have certain math skills. It would not be real good if next year in 9th grade, when she just got through all of this Algebra 2 stuff, that, she started doing calculus, right? Because that's not where she's at. We need to meet her where she's at so that we can build her skill set. The same is true in communities. We need to meet communities where they are at in their capacity for change so that we can help build the skills that our community might need for change. And so then how do we do that, right? Well, the first place that I looked is this. Some of you may have heard of it before. It is the triethnic, it's sometimes referred to as the triethnic model. I may refer to it as that. But this was a publication, I think that came out of the University of Colorado, I think, in the late 90s. I think this manual actually came out in like 1997, I think. And there are lots of community readiness models out there. This is the one that I use the most with communities, and turns out with states, the state I'm working on using this. And I use it for a reason. The first is I always turn to the science. If you look up community readiness in the journals, in the real journals, you'll find that this model is used all over the place. That doesn't mean that it's always demonstrated to be effective all over the place, but mostly it is, right? Most of the research focuses on the triethnic center, and most of that research points in a positive direction to that. Another element of this, though, that's important is that it is very easy to adapt. It's highly adaptable, and we'll talk about that in a second, meaning that you can use it in a wide variety of conditions for a wide variety of issues. And the other is that it's very specific. If you do a community readiness based on the triethnic model, even if you don't use the exact model that they put out there, but you basically try to follow it, it's going to pretty much put a bright neon sign on where you should try to enter in increasing your capacity. It is very specific in terms of the stages that it uses, so that you can correctly identify where your community is and then start building from there. Now, as I mentioned, I just mentioned the word stages. According to the Triethnic Center, there are 9 stages of community development for community change. And there's also 5 dimensions. That is to say, there's 5 areas that make up community readiness. And so let's talk about first the adaptability issue, because I think that's key for us, right? Particularly for you. Boy, it's kind of a complex model. What I was referring to earlier is they actually have 2 manuals for it. One is, I think, about a 50-page manual that talks about how to do it, and it contains worksheets to help you work through it, all of that. And then there's a separate scoring manual, which is much shorter, to be fair, but can get a little in the woods, right? So we obviously are not going to ask for the full-blown version. That's the face-to-face version that you see on the slide on the left, right? The face-to-face version, that is to say the model as it was originally created, specifically focused on doing face-to-face interviews with a set of protocols designed by the Triethnic Research Center that you are supposed to walk through, including who should be a part of the interview. So you're going to identify people in the community, just so you know how the full model is supposed to work, so that when you make adaptations, kind of we know how far we can push, right? The way the model is supposed to work is you choose key stakeholders, and these key stakeholders should meet one of two criteria, or sometimes both. One is, as most of you are familiar with stakeholders, right? These are people who know something about the topic in the community. Okay, well, yes, it's important to get their feedback, but it's also important, since we're talking about a process of community change, to get people who understand community change in the community. So they may not know as much about the individual topic that we're talking about. They may know a little bit about that, but maybe they know a lot about how the community changes itself, or what kinds of resources are available, or how resources are distributed in the community. What are the politics that are going on? It's important to be able to understand that. So face-to-face then is a model where we would show up at someone's office. We would have a couple of people with us, one person to take notes, the other person to ask the questions. We would go through a protocol list of questions And then we would take those questions, the answers to those questions, analyze the text, and come up with scores. Those scores would then tell us what level of readiness a community is in. Now, I have done that before with communities, and one of the things that some communities that I've worked in wanted to do is they also wanted to get the community's perspective, right? Because let's face it, after all, we're only doing stakeholder interviews, so it's possible that there's an error rate that we're not comfortable with in just interviewing a handful of stakeholders in the community. So we want to know, what does the community think about these issues? So you can have a community survey that is based on the interview protocols for the face-to-face survey, so that you can have community members ranking the community on the in the 5 areas that we're going to talk about in a second. The other is key staff, and this is where you guys come in. This is where we thought it would be helpful for you, is you can sit down with you and your key staff, or maybe a couple key members, and we're only thinking about just a few people, two maybe, just to see where you think your community fits right now in terms of community readiness. Is your community ready for change? And so what we've developed, and we'll bring that up in a second, is a tool that you can use to begin that kind of conversation. So when we're talking about adaptability, we're talking about a variety of ways to a variety of audiences in terms of where we're going to get the data from. And it is highly adaptable. And the research that I was referring to earlier actually refers to multiple different models of data collection. Some of them just do face-to-face, some do community service and face-to-face. Any combination of these can be very helpful. All right, so let's talk about then what the 5 dimensions are. So what makes up community readiness? Well, one of the elements that makes up community readiness is the community knowledge of what we call efforts, right? It's not just asking what does the community know about the problem, it's asking about what does the community know about what's going on to address the problem in the community, right? Because if the community doesn't know what's already being done, it may be very difficult for the community to know what the next step should be in addressing a problem, because we don't know where we are, so that makes it harder to know where we need to go, right? So one of the sets of questions that we're going to ask about is how much do you know, how much does the community know, about the current programs and activities? And this is one of the questions that you would ask yourself or that other staff that you would have a conversation about. And in the tool that we've designed, there are actually 6 questions, I think, that make up this dimension of knowledge of efforts. Another thing that's important to know about is assessing leadership. And specifically, what is the leadership's attitude towards addressing the issue? We also want to know about the community climate. And this is where we're just going to think about the community's attitudes towards the problem itself. So we're not going to specify, do you know what's being done to address the problem? We're going to ask people, how big of a problem is it? Is it important? Is it something that really impacts our community? These questions around community climate are another area that becomes very important to know if we're going to start going to the community and telling them we want their support, right? Where are they on this issue? We're also going to talk about what you know about the issue, right? How much does the community know in general? I just want to, again, differentiate that, from the community's attitudes towards addressing the problem, right? Here under community climate, we're asking specifically if they think they're ready for a change, right? Under community knowledge of the issue specifically, we're asking, what do you know about the issue as it is? So from the community perspective, we're asking stakeholders or staff or the community itself to reflect on how much do you know about the efforts? How ready or likely do you think change can occur in this area? And how much do you actually know about the issue? We also are going to ask questions about resources. How many and what kinds of resources can be used to address the issue? So for example, and this is different than efforts, although it does overlap with it a little bit, but it's really thinking about if we're not doing a lot in a community, what are the resources that we could easily access that would give us a leg up in terms of addressing the issue? So resources then is slightly different than that other question of efforts. Okay, and so within this, then, as you collect all of this data, eventually you will end up having to score it. We have simplified the scoring system. The actual scoring system says that you can range somewhere in this 9 levels or stages of readiness. And those stages range from kind of, you know, the number 1, they rank it as a 1, which is no awareness, to communities that may have some type of denial or resistance, to communities where there could be a vague awareness. They kind of know things are going on, but they really don't know what that is, to a pre-planning stage, which is actually where the community has more than vague awareness. So maybe they're ready to start implementing resources in a more effective way around something, but they actually haven't started doing it yet. And they haven't really had conversation about doing it, right? They're ready to have a conversation. Preparation is maybe there have been some preparation already that's been engaged in, but maybe nothing has really happened about that. Initiation means obviously that something has been initiated already. Stabilization means that those things that have been initiated are a relatively common part of community life. Expansion means that if they're a common part of community life, that the community may be ready to expand those efforts even more. And then the top stage, the 9th stage, is community ownership. As you're looking at all of these stages, again, I said we simplified this a little bit, but you should be aware, and you should not be shocked to hear probably, that most communities who are engaged in these types of issues around prevention rank relatively low on community readiness, right? Most of them rank below the pre-planning phase. And the reason for that, of course, is that if you had high community readiness, that is to say, if you already had institutionalized mechanisms for effectively dealing with these intervening variables, or effectively dealing with substance use or marijuana use, alcohol use, prescription drug abuse, if you already had mechanisms in place that were effectively managing those, probably your organization would not be prioritizing those as problems, right? It's the areas that need improvement, where resources are not being spent either at all, you know, in terms of the quantity of resources, or they're not being spent well, right, in terms of quality. Either one of those is going to align themselves with lower levels of readiness in terms of what you're doing. So it's not uncommon, it's very common for communities that are working on various issues that they're trying to take on to be ranked a little lower. Okay, so we are designing a tool. You know, this looks like a design tool, but it's not. It kind of is. We're trying to improve it right now because it does take some average scoring, as I said, right? So we're designing a tool that's based on the tri-ethnic model. We have come up with a survey that aligns with each dimension. So basically, the tool that we're going to provide for you has 5 questions on it that you're going to look at. And the different scores that you can get align with the different stages, and in a minute I'll show you what they are. And all you really have to do is just identify the statement that you think best describes where your community is at. So using this first one, for example, if you can read what we have on the screen, it says, please indicate your perception of your community's knowledge, right, about efforts to address, meaning programs, activities, or services, the issue mentioned above. So the worksheet, you're going to put the issue. Now, what's also important to know about this when you put the issue is that intervening variables do not go here. Okay? For community readiness, we are interested in assessing a community's readiness to deal with a specific behavior. In this case, the behavior might be youth alcohol use. Maybe it's marijuana use. Maybe it's prescription drug use. So when we're doing community readiness, we're going to keep it relatively vague, right? Because the community, it's not fair to think that the community would have knowledge about specific intervening variables. If they already had knowledge about specific intervening variables, you wouldn't have to identify what the intervening variables are. You would already know since you're in the community, right? The fact that they have not been identified yet means that we can only assess community readiness from the perspective of dealing with, in our case, specific substances. So a substance would go in this issue, or the issue for this worksheet is. There is some disagreement in the literature about whether you should put alcohol use or underage alcohol use. I think for our perspective, we would stick with the underage part, right? Because the mechanisms for change that may be occurring for adult use might look very different. The intervening variables for adult use probably look very different than they would look. So we're trying to get our community's assessment on, can we address underage alcohol use? Now, one of the things that's important to keep in mind is some of these other questions are going to cover things like if you have a community where there's a lot of adult alcohol use, meaning it's deeply embedded in the community, then probably that's a challenge for your readiness to address youth, right? But that is covered elsewhere in the questions. So those types of ideas will be able to come out. And basically you can see that this is the efforts to address. And as I said, there are 5 that are reflected here. I think, yeah, 5. So how much of the community actually knows that local efforts exist to address the issue? And you would rank either no community members, only a few community members, at least some, which is more than a few, many, and then the last category of most, right? And you're going to do that for each question. There's no data that's required here. It's just your perception, and that's part of the utility, also part of the limitation, we'll talk about in a second, in the tool, is that people really don't have to have any specialized knowledge, right? The stakeholders that you interview, the staff people that you're going to use, you're just giving your opinion on this, and then working from there. Again, we're expecting that folks will just do this at the individual staff level. Probably you will, in answering these questions and being more thoughtful about what community readiness is, my guess is within a normal margin of error, most of you kind of know where your community is in terms of what stage they're in. I don't have any doubts about that. Having used it a lot, usually there's not a great variety. There are very few communities where some people who work for some agencies think that there's a really high capacity, and then other people in other agencies think there isn't. Usually there is agreement. So then you score each element. Again, for a couple of the elements, there's an average score. That's what we're trying to simplify. And then the other 3 elements, so 2 of the elements require this kind of answering, right, where you're going to answer a bunch of indicators and then you come up with an average score. The other 3 elements of the 5, you just pick from a list of sentences and you say which sentence best describes where you're at. And then that becomes your answer, and you just score whatever level that is. So the tool that we're coming up with, we haven't decided yet if it's going to be online or not. We are trying to finish it up, and you should have it by the end of the week, certainly, to be able to take a look at that. Okay, so let's keep moving then. All right, so part of what we wanted to do is we wanted to simplify the scoring process. Notice that there were 9 stages before. Again, a reminder that there are a couple things that we can use this for, right? So for some of you, you may have only identified one key substance that you're focusing on. Others may be focusing on 2. Some drug-free communities coalitions, I think, focus on 3. Doing a community readiness assessment for each substance allows us to compare between substances. So you would not do a community assessment on, say, underage substance use. You would do it under underage alcohol use. If marijuana is also an issue in your community, you would do a separate one for underage marijuana use, right? And then that allows you to compare for what types of substances is your community most or least prepared to take on? Because this will help you design your strategies and help you prioritize where you need to start. Right? It also, by the way, will reveal areas of strength or challenge when you're thinking about what are the intervening variables that we want to work on. Because as I said, this tool is fairly specific in terms of why you're getting a high or a low score. So you may be able to more readily address some of these intervening variables. Certainly with the strategy set that we looked at with prescription drugs, for example, we would choose which of those things we would want to do first, maybe, based on what we know about our community readiness. And there are some places we may not be ready to implement a change. Other places would be. So community readiness should help with that. Also help you design what the strategies are that you're looking for. So how much information dissemination? Is there a broader, for example, type of information dissemination that you have to engage in because you know the community is not ready for a change here? So there's information that you may need to put out there that may not be directly related to the intervening variable or directly related to the strategies, but may just involve the substance, that we just need to increase our community's understanding of what the community is already doing, or we need to address our community's understanding of the substance use, or we need to, get our leaders on board that maybe, there's a perceived lack of leadership in this area. So these are all things that tell us when we're designing strategies, where do we need to start? And the last part, and the part that's near and dear to me, is we can think about readiness as an evaluation tool, right? Because if nothing else, one of the things that in thinking about community readiness should help us do is it should help us improve community readiness. And so while there might be some changes or some strategies that we know are going to take a long time to implement before we start seeing changes in data, community readiness is not one of those things, because we can assess community readiness once a year if you want. I've seen some groups, when they first started out, they did it every 6 months because they felt like they were really ramping up. So this brings up the other element to this that's important to know. We don't know right now, the science does not know which came first. Do you have to have community readiness before you start your strategies? We don't know the answer to that, but we know that there's a very strong correlation, right? We know that as community readiness increases, so does successful strategy implementation, which means the reverse is true as well. So part of it then is thinking about, as we're implementing our strategies, how can we be helping our community readiness? Because when we talk about community readiness, what we're, another way of viewing community readiness is community capacity change. And so just like we always want to be improving our organization's capacity for change, we also want to improve the community's capacity for change. This helps us think about that. How are we going to do that? I think it's also important to differentiate, to make very clear the differentiation between community readiness assessments and the human, fiscal, and organizational capacity elements. They are different. And they're different because the logistics of the day-to-day implementation of the strategies falls on the organization. The community will play a part in that, but in the end, it's the organization's skills, fiscal resources that are going to determine the success of certain interventions. And so when we're thinking about, when you're filling out your sheet and you're thinking about how do I use these two together, it's important to remember that they each cover different things, right? Community readiness talks about the broad context of community level change. How ready is your community for a change in this area? The other pieces talk about can your organization successfully implement the changes, identify and implement the changes that you need to make? And so what we've tried to do then is create 2 different tools that will help you with that. So the last time that we had a webinar, right, we talked about this tool that you can use to assess your organization's ability to engage in the logistics of change, identify what needs to be changed, and engage in the day-to-day logistics of implementing that change. And so that's why we have this worksheet that just helps you think about that. Like, is our organization ready to do this? The other part of that is the community readiness piece, which is around this issue of marijuana use, of prescription drug abuse, whatever. Is the community ready for that change? The way that I think, everything at some level seems to go back to COVID, but I would think of it this way, right? So in the last couple of weeks, I've seen lots of interviews. I've known a few people who are restaurant people. And, there's this difference between a restaurant saying, yes, we can open up. We have cooks. We have everything that we need, right? That's the organizational part. We're ready. Like, we know what we need to do. We have the capacity to do it. But on the other side is, who's going to show up, right? Are we going to be able to draw people to our restaurant if they don't feel safe, right? To me, that's a clear example of the difference between your organization's capacity to implement a change and the community's readiness to accept that change, right? And so that's what each of these hopefully will help you do, and of course we can help you with all that as well. So I just wanted to talk about this very quickly, right? This is the infamous assessment grid. Hopefully not infamous, which mostly Melinda, I think, has worked very hard on. But you'll notice that under changeability is listed human capacity, organizational capacity, physical capacity, and community readiness. That's the community readiness is a little blue. So what we would recommend then, so this is one where it says the substance is tobacco. So what we would do is we would do a community readiness around tobacco. So we're going to use the template that we'll give you, that you would use just with yourself and your key staff maybe, and you are going to then self-rank your community readiness based on those tools. And then and that community readiness score is going to be the same for every high priority intervening variable that you have, right? Because community readiness for change around tobacco is not going to change depending on what intervening variable you're going to use. But what will change is your human, organizational, and fiscal capacity to implement that change. So when we're thinking about high priority intervening variables, and our hope is that you only have like 2 for each substance that you're working on, is that you would score those differently, right? That you would think about what's our human capacity, organizational capacity, and fiscal capacity maybe to deal with retail access to tobacco. And is that the same as our ability to deal with social access to tobacco? Because they may be very different. But a community's readiness to deal with changes around tobacco use doesn't really rely on a difference between intervening variables, right? So I hope that makes sense. So with human capacity, organizational capacity, and fiscal, see, I'm not getting any feedback because I can't see anybody. So I keep repeating because I just want to make sure it's clear. With human capacity, organizational capacity, and fiscal capacity, we're going to redo that for each each high priority intervening variable we come up with. With community readiness, once we identify our community readiness around the substance, that will not change as we go through. So I hope that makes sense. And if it doesn't, please ask questions as we go. So this is the part of the program where I sadly sign off, covering the information that I wanted to cover. I am going to turn it over to Melinda for some specifics in terms of dates, times. Yes, this is time now. In terms of dates, next steps, I would like to say before I do that, that we are developing as I said, the assessment tool. We actually had one, just to be fair, we had one and a couple of us tried to use it and we thought maybe we could make it better. So just so you know, we had one that we thought we could go with, but then when we actually tried it out, we were like, maybe we should just try to make this better. So we decided to wait a couple days. So I apologize for not having it ready right away, but we will have it very shortly. And again, if you require any technical assistance around this, please feel free to reach out to any of us. We've already had a couple of people who have reached out to us. I guess the last thing that I wanted to just briefly talk about, which I guess maybe Melinda will talk about a little bit more, is that we are also in the process of finalizing a rubric that we're going to use to assess. That's the template review part that's up there on the screen. We're developing a rubric. We already have a rubric, but again, it's one of these things that when we developed the rubric, we didn't think it was going to be a mass consumption document. So we're kind of converting it from the version it's in now to a version that will make more sense to you and be more helpful to you, so that when you give us your assessment and we review it, you're already going to know what we're going to be looking for in that review. And then when we give you feedback, that feedback will be in the form of the filled out rubric, so that we'll be able to speak the same language in terms of what we see as the strengths and the areas of challenge for each assessment. That way, everybody gets treated the same way, and hopefully the feedback that we provide is consistent regardless of where you are as an organization. So having said all that, I will now turn it over. I hope I gave Melinda enough lead time and turn it over to her. And I thank you all for participating today. Again, if you have questions for any of us, please put them in the question box. Melinda, I am going to mute.
Okay. Thank you very much, Bill. As Bill had indicated, we do continue to be accessible for TA appointments. Jamie has sent out information recently about how you could schedule that, but we are happy to meet with you individually. We are also very happy to review your template, either when it's fully complete or in steps, to get feedback along the way. And Jamie has also sent out a link to show you how and where you can submit that for our review. We are going to be doing those in once a week. So they'll be depending upon when your submission happened relative to when we do those. It may be up to 2 weeks before we're able to review. We do ask that if you would like to have your assessment reviewed before you formally submit it to the state, we would like you to ask to have that submitted by July 15th. That will enable us time to review it, get some feedback to you, and then if needed for you to have time to make adjustments before you submit that again. As Bill mentioned, we are developing a rubric, and a rubric, for those who don't know that lingo, it's basically just shows scoring criteria. So it shows what we're looking for at different places in the assessment to decide, does this do what it's intended to do? We think that you'll find that very useful and helpful as you complete your assessment, to know what people will be looking for. Relatedly, we have gotten some questions about how to approach completing the template. We are filming a video to distribute to you on that, which will also have a PowerPoint that give tips to show how you might most efficiently fill out the template. And that should also be out about the end of this week or early next week. The assessment is due August 20th. and we will be happy to help you pretty much any time before that time to answer your questions about your assessment, provide that one-on-one kind of feedback of special situations which you might want to hear brainstorm different options about how to deal with those things. It is our goal and has been all along that this assessment not only meets your requirements for the state, but that it can also be meaningful and useful for your community. And with that, I open this up to questions. And I'm going to ask Jamie if people want to submit a question, if he can turn voice comments on, but you could also submit a question in the chat box, and we will be happy to hang out for longer.
Or if you want to join us via audio, just raise your hand or send a message in the question box. We'll be happy to help you. Melinda, we do have some questions.
Oh, I don't see them.
A primary question is, Melinda, actually you just answered. We will have a recording of this video and the slide deck on the help desk this afternoon, as soon as we can. It takes a couple of hours to process via the system and for us to edit and render and process and upload. So it'll be there by 6 or 7 o'clock. We will also include the slide deck as well. And let's see, Melinda, I do think we have a question from Zorana. On step 3 of the assessment template under changeability, human changeability, what would you like to see? And can you give an example?
Bill, do you want to respond to that?
Try it again. Okay, so yeah, I'm hoping everybody can see the slide that's up. You can't tell. Yeah. Can everybody hear me?
I can hear you.
Oh, okay. Okay. So it's been kind of wonky. Like, yes, I agree that Linda, I don't have any questions on mine either. So I don't know. So anyway, yes, the human capacity piece comes out of this worksheet that is available that we covered in the previous webinar. And so that would refer to, again, we're thinking about the intervening variables that perhaps the strategies that we're thinking about implementing, and we're asking ourselves questions as an organization relating to our human capacity. And those elements are listed here as prevention training in degrees. So do we have people who have a high level of training in not just prevention, but maybe in the area of prevention that we're thinking about working in? Do we have good project management for multi-layered types of projects, which of course all community projects are, because you have to operate at both the organizational level and the community level. What's our years of experience in prevention, years of experience with youth, if we're talking about youth prevention? Do we have an adequate number of years of experience working on what I've identified as the independent variable, so whatever substance it is, for example, that we're going to be working on? Do we have a way of implementing performance measures, assessment indicators, feedback? Do we have experience with doing that as an organization? Do we have any experience with workload analysis? Again, this was an element to make sure that we don't just have like one person doing all the work in our organization, right? We need to make sure that the work is distributed in a way that helps maintain our sanity, but also helps to make sure that the work is going to be done most effectively. And then do we have timely feedback and hiring mechanisms? So if we, first of all, do we have a way, this is related slightly to the workload analysis piece, which is why they're back, but are we able to assess whether the people who are working on the project are doing a good job or not? Do we have institutionalized ways of getting feedback to them, also getting feedback from them? So if they have challenges, are they able to communicate those challenges to the organization so the organization can help them resolve it? And if we need to have other types of skill sets at the table, maybe consultants, something like that? Do we have mechanisms in place that will help us bring those skill sets to the table for our organization? So I'm hoping that that explanation of those, 8 elements is what makes up human capacity. And then for each of those, it's not very scientific. Again, it's just saying, yes, we have it, we sort of have it, or we don't really have it. And maybe there are some notes in that last column that you may want to jot down some ideas relating to that. And so you would look at how you answer those questions in terms of yes, sort of, or not really, around that intervening variable that you're thinking about approaching, and maybe help sort through which intervening variables you want to use based on, in part, your human capacity, which revolves around skills of individuals. Do we have the skill set in our organization to try to manage, as I said, like social access? Do we have the skill set to manage retail access? Do we have the skill set to manage, youth stealing prescription drugs from home, right? Do we have the ability to do that? So hopefully that makes sense. If you need more clarification on that, we're happy to set something up to talk about your specific situation.
I'd just like to add that while you consider all those factors that Bill had mentioned, they're very critical to knowing if you can actually pull this off. You can, in the template, include that as kind of a summary measure. So if you're well suited to do that, you could say something like, we have the capacity, we have sufficient staff with significant experience in implementing interventions that target this intervening variable. If that's not the case, you could say something like, we have sufficient staff to be able to do this, but we would need training in XYZ to support us in doing so. We do have the resources to get that training via this funding source. You can kind of aggregate that information to talk about it in the template.
Yeah, and if I could just add to that, so there may be some things where you might feel that there are maybe certain fiscal capacity elements are less than human or organizational. That too could be something that you could mention in the notes section or whatever that says, we feel that there are some things with our fiscal capacity, but as Melinda just said, we also feel that we can, we might be able to raise that a little bit. This is really just, this isn't any formal scoring. This is just so you can think about in advance what your opinion is of your organization and its ability to successfully do this, and help you identify what are some of the skill sets that you may need.
Are there other questions?
Any other questions? Again, we're happy to provide audio permissions. Melinda did reference we've sent out 2 emails week before last and last week, directing users to the news page on the NCTTA website. You will see a new posting there that, and the email said this actually, provides information, directions on how to submit documentation, template materials for review by July 15th. And we're basically using our help desk feature within the website. So you create a help desk ticket, attach your individual assessment file or files, submit contact information for yourself, and the template material that you want to be reviewed is automatically sent to us. You will also receive a confirmation email automatically from the system as well. If you don't receive a confirmation email from your help desk ticket submission, let us know. There's also a comments box on that page for any questions or additional detailed information you want to share. Plus, you can always use that same link for any other technical assistance issue, or to ask questions about the assessment process in general. We also have a somewhat of an unusual survey that will be distributed 60 minutes after we close this webinar session, or a little bit after, based on when we close the session. We're all accustomed to receiving after webinar surveys. Well, this is a maybe 30% after webinar survey, then 70% collection of anonymous questions that's 100% private, where we're asking you about your current experience, response and reaction to the documentation and materials that's been provided, concerns you have, items that we need to start tracking, problem areas, and so forth. So please take time when you receive the after webinar email. Those are always really important, but for this particular topic, it's really important. And Melinda did mention that we will be releasing the formal process to upload official documentation and your final submissions later on. We probably will not release that process until after July 15th. Why July 15th? That's subject to change, but we want to leave that window open for folks to send in draft materials to be reviewed. So we really do encourage you to submit material that you want to be reviewed, and the Wake Forest team can review those items. We will be serving as somewhat of a coordinator of files upstream to Wake and downstream back to the provider. So we'll make sure that your files are appropriately getting to the appropriate folks and getting back to you at the same time. Melinda and Bill, I don't see any other questions. And our time is about up. Any final words?
Again, we are readily available to assist you as you work through the assessment. We encourage you to ask questions, big or small. We do also encourage you to go ahead and submit your templates as you progress to get feedback. As you may remember, Jessica did indicate that she does not want anybody to proceed with their work plan until their needs assessment is approved. So getting that assessment beforehand will likely speed up the possibility of when you can start your FY 2021 work. And I think that's it, but again, we're happy to stay online for a few more minutes if people have additional questions. Otherwise, you are able to reach out to us to get additional assistance.
Thank you.
So I just wanted to say thank you to everybody. And I know that coalition work and community change is a little difficult. So remember the immortal words of the Eagles who sang, "Take it easy, don't let the sound of your own wheels drive you crazy."